So let's start with like a general introduction where you tell me a little bit more about your organization because I don't know much about it.
Sure. So Next for Autism is an organization that's dedicated to improving the lives of people with autism. And we do that by developing and launching innovative programs. We've been doing that for about 15 years. And we started with the support of developing a charter school that's currently in New York City, certainly impacted by the COVID-19 charter school that's in Harlem and then replicated to the Bronx. And over the last 15 years, we've developed additional programs for recreation and leisure, and then community living and employment. And again, really just kind of committed to quality programming for people with autism. Right now, we are primarily focused on the needs of teens and adults with disabilities and autism.
And how do your members, like all the people with autism, cope with these uncertainties and how do you help them cope?
Yeah, so that's such an important issue. And, I think that we're all trying to engage in the best resilience that we have, these strategies of self-regulation and trying to, I think those of us that are considered typically developing, we're struggling as well. And so for people with autism, it's helping them use some of those compensatory and, anxiety reducing strategies that we hope that they've learned. Next for Autism has been kind of releasing some content digitally on here's some strategies. And, one of the things we, talk about is, we're all working from home. And what if you are an employee with autism who's currently working from home? And that's a huge disruption in routine. So do I know how to ask for the appropriate support from my supervisor? Do I know what to do? And, meanwhile, the supervisor is dealing with their own repertoire of challenges, but really how do we develop those resources, that content support, information for those adults?
And are there specific strategies? How do you protect them? I don't know if some of them are also in the high risk group.
What we also think about, again, is what are the effective supports that would allow someone to continue to engage in their daily life to the greatest extent possible effectively. So that is making sure that they have their communication supports and that they have information. And, a lot of people with autism they benefit from kind of visual information. And so can we write things down for them? Can we make sure that there's lists? That's I'm looking at a list right now. That's good for all of us. But I think that's also something that people with autism really benefit from. And so how do we help families that are impacted and then the professionals that are supporting them and supporting people with autism with this disrupted routine, right? So, my routine has typically been, I get up, I maybe go, to a day program for the day. I come home, I see my family on the weekends, which now I no longer am able to see because we're distancing in that way. And so that is a huge routine disruption.
Yeah. And how has this whole pandemic impacted your organization? Like if you tell me a little about your usual everyday life and how this has changed.
Yeah, so our organization, again, we have these partner programs that we work with that we've developed the relationships with over the years. And what we're doing right now is try to support those partner programs to be delivering the most effective supports possible. Those programs were all in person, and some of them have gone virtual. And so that's, something that we're trying to help with, support with through, technical assistance, through financial support, all of those things. So the children from the charter school are able to have the access to curriculum, and the people involved in the recreation activities can now do that online. But some of the programs are also community living programs. And so those programs aren't shut down. Those are homes, so what do we, how do we support them? And that was some of our effort with the relief fund. Was the protective equipment was one of their primary asks. And we wanted to be able to deliver that.
Did you get any sort of feedback from your members, like about how you support them or did you get more questions and emails during that time right now?
Yeah, I think there's actually more engagement because we're all trying to be supportive of each other. And I think that's the benefit of having an engaged community is, what about this? And does this work? And we started a webinar series for employers because we knew employers were like, well, I want to support my employees with autism, but I'm not sure how. And we have 100 slots every week in the webinar, and those, these are just free information sessions, and they are packed every week. That session is filled up. And so, I think people are really hungry for information because they want to do it right. They want to do the right thing. And they're looking for resources, and we're able to offer, the team at Next for Autism has a lot of experience, a lot of expertise. And so we're able to offer some of that support to people that maybe are engaged in the current work, but may not have that extensive history. And we want to make sure people have access to the right information.
How has your personal routine changed? Because I guess you're at home, obviously, right now.
Yes, I am.
So what else did change?
So here we are talking on a computer, which I think is become most of our, all those funny conversations about I'm zoomed out, it's like, and I think that's just trying to be as present with people as possible when you're engaging in this virtual work. I also want to say that there has been some, I think that people are looking for silver linings because that makes us feel better. And I have heard from some of my friends with autism, adult friends, how they're like, this is actually, they are, of course, gravely concerned about health and welfare of their families and the community and themselves. But they also have said, I really always wanted to work from home, but my job didn't really afford that. And now, this is actually working out quite well for me. I really like this medium. I like having my autonomy or my ability to do that. And I'm like, okay. And I think that's true of many individuals, right? There's there's pieces of this, there's pieces of this crisis that has allowed us a window into other creative opportunities. With crisis sometimes comes creativity, and these creative solutions for some have, become a silver lining.
So I wanted to ask you, I don't know if that's too personal, but do you want to share your motivation why you work for this organization?
Yes. So I have worked in autism services and supports for 30 years, a little more than 30 years. And Next for Autism is committed to developing quality programming and making sure that people with autism have a high quality of life. And I am someone who's committed to social justice. And I understand that the people with disabilities in our current society are not afforded the same opportunities. And we're seeing that, even within the current healthcare crisis. And I have seen that in my work. And I want to work with an organization that wants to change that.
If some of your members with autism, if they have some high risk factors, are you somehow concerned, especially because you're in New York, that those triage protocols will affect them negatively?
Well, one of the positive aspects that came out recently was, we know that people have been alone in hospitals, and that's a heartbreaking. We hear the stories from popular culture media. And it had been the protocol that individuals had to be alone due to the transmission factor. And most recently, it has been modified so that people with disabilities, people who need someone to be there with them as their advocate and their, to assist with communication and decision making, is now able to be there. And I think that's a really important, things are changing fast. And I think the health community saw that that was not going to work, and that those individuals were not going to receive the best care. And we know our healthcare providers want the best for everyone. And so that was a modification. So I think that's an example of how we need to make sure that everybody gets what they need. And for some people with autism and developmental disabilities, that means that they need to have a health advocate with them. And we've been engaging in some communication around that of here's the things you could think about. Here's your patient bill of rights, making sure, because things are moving so quickly and our health system is so burdened that we just want to make sure that everyone's working together.